So, first of all, thank you very much for having me elected. And we also had a very, very productive discussion this morning. We will try to summarize a few points. First of all, here is the team. So, as vice chair, also in this working group, we decided to ask to 3 people to take this position. One is Thierry Baston from Cyber Nano, which was really helpful from the beginning when we started to set up this group. So we basically built the first proposition we presented this morning together. And I also think that Andreas and Daniel can have a very active role, and they had very nice propositions as well during the meeting we had, so they agreed to contribute to that role as well. So just as communication, we can add them to the group. Yes, and so they will join, if they are free, they will join the meeting. We will have, I will not be there tomorrow afternoon, but so with the new team. Okay, so this is the tentative action plan, so a few bullet points on the tentative action plan that we were discussing this morning. First of all, as we said, so to be more problem-solving orienting, and so one proposition was to rewrite the description of the working group in the working group page in order to be more aligned with this philosophy also that will be with Horizon Europe. And so in this sense, focus more on what characterization and safety could provide, for example, for regulatory purposes, to define critical quality attribute instead of defining nano. And so we will reshape the description of the working package with the aims in the working package place. So then the second point, well, of course, one of the first action is to list the people that want to be involved in the activities of the working package. So creating some yellow pages with, first of all, listing the people, so but not just having their email in order to keep them in the loop with the activities of the working package, but also asking them to describe in a few keywords their expertise. Because one thing that we think is very important to improve the networking within the ETPN is also to know and somehow to list what are the research fields and expertise which people can provide in interactive collaborations. So the action would be to circulate first a document to ask for the email addresses and also for a few keywords in order for us to know in which kind of fields or for which topics we could interact with you, as also people in the ETPN could interact with you. And I have started to list the emails from the people who were today at the meeting, but if there are other people which are interested in participating to the activity of the working group, please contact me, and so I will add you in the mailing list. I think that there are also people who were in other working group sessions that may be interested in joining, so to join forces. And the other point would be also to try to list not only the people, but also the facilities which are active in safety and characterization, so that other members of the TPN know who can contact which kind of service or expertise and access to instrumental facilities. So that would be the second step. Okay, so the other point we want to promote a bit more and increase the outreach of the current initiative on safety and characterization. So this morning we listed around 10 projects that are ongoing in the field, and we want to put a small description of each project in the web page and with a contact person that was indicated for each project. So this will help to send contact with, to setting more contacts with ongoing projects. And one other thing that we thought was also an interesting idea was to try to set a newsletter, maybe just on the web page, so just something that we can put on the either on the ETPN open website and or on the working group web page. So without accessing to the internet, each month or 2 months is put a newsletter which is related to particular project to share progresses, for example. So this is also another initiative that we will start. So we have already addressed one leader for each project, so we know who will be responsible for each project. Also in terms of sharing, one thing that when we were starting to discuss with the group, we thought that is really important is also to increase our effort in training and education. And so in this sense, we will try to help the working group of education and training and try to promote all the initiative and ongoing trainings and also workshops or other initiatives which could be helpful for educational purposes which are related to safety and characterization. And also this is an information, a useful information that we think can be shared in the open ETPN web page or in the work group web page. So then, as we said, also for 2 main reasons. First of all, to increase the networking, but also to stay the think tank, as Ruth said, of in the new Horizon Europe. We can use the new ETPN intranet, which allows us also to create forums for discussion. And so in order, and this is a proposition, so to select a few topics within the working group, but also across the working group. So try to do that together also with the whole team and propose some discussions. Of course, this is something that we have to moderate, that we have to also to encourage people to start using the ETPN intranet. And so for doing that, our active plan would be to define for the first period at least 2 topics we could focus on. So we will circulate a survey, so first ask for propositions and then circulate a survey and select then 2 topics and start to create discussions into the forum. And again, this will be within the working group, but also across the different working groups, so it's something that I would like to open to all the working groups. Another point that came into the discussion was that it should be possible for the ETPN members to address each working group or experts within the working group to ask specific questions. And I discovered that this tool is already there into the ETPN intranet, and so we should. I didn't know that. Maybe we should render it more visible, but this should be something that is also another additional benefit for the ETPN members. So then these questions could go to the the working group chairs and vice chairs that could readdress to the expert in the field. So this is also something that should be possible to do. And then one other thing, that there are some interactive tools that are already available from, for example, from the safety by design domain in order to help ETPN members to identify needs in safety and characterization. So we are aiming to share that as well. So there were 2 propositions from Thierry and also from Peter. So this is something also that we can do. And of course, the other point would be to help the education and training working group to collect material to build this knowledge hub. And here there was a question on how to deal with the copyright and with the GRPR, but this is something that we can address together, Jack, but that is something also that we would really like to interact with you in order to help to build this knowledge hub. And okay, so this is just the list of the projects that in safety and characterization with the people we would address to have a newsletter and updates on a regular basis. And okay, so these are the key decisions. And another point was that we would like to set up a teleconference each 3 months. So the first will be in September in order to update and to see what are the progresses and the new actions that within the working group. And so it's up to me to send a doodle to define a date. And then that is, of course, that the take-home message would, as I said, it will be, of course, to be in line with the new Horizon Europe objectives, and this is really a challenge that we have to face all together. And also the importance on having the participation of other communities, so with the cross-fertilization strategies. So I would really, if you have people that you would like to be involved, and also trying to share the invitation to join, and also, of course, we have people within the working group and within the team that are on different communities, so try to push for cross-fertilization. And of course, it will be very important to keep the working group active, so this is why, in addition to have teleconference each 3 months, if this work, it would be nice to find a way also to found some face-to-face meeting, also with some back-to-back to common events we still have to figure out, but that would be important as well. So that's all. If you have questions or...
One short question. First question of Marco of the conference.
Very nice presentation. This is an open question for everybody, because something we also discussed in our working group session. So there's clear the need to increase the benefit for the current member. I think we need to think about the strategy to how tailor it, because when we approach new members, we need to make sure that there is a benefit from the institution, because the institution pays the fees, not the PI. And also, if I want to convince, for example, my university that it's very good to keep paying the membership, it's always easier to make the case that some intranet is not only available to me, that I'm traveling to ETPN or to my colleague is traveling with me, but also for my students and in the college. I just, it's an open question, is that I wonder if we can open the intranet to a set number of people from each institution. That could be PhD students, postdoc, or...
Virtually, you can add as many people as you wish. Normally, the average is 3-4 per institution, but some of them goes to 10, 15 of them. So I would avoid to, let's say, put people for having them inside and just to receive more emails and blah, blah, blah. But if you have even students affiliated to your organization that would really benefit from being in the let's say, in the, I lose my mind now. In the? Okay, that wasn't the idea, but on the intranet, just add them. It's open. Which is just a part of the question, because the most important thing is to show them there's an interest to come, if there are PI students, BDs, I don't know, like.
And maybe one additional thing that would help would be to define which contents could be in the intranet, but we should also have some contents that are open as a, yes, as a showcase of what just to interest and get people engaged. So that's. Thank you.
Okay, now we'll move to business opportunities with Rui Souza.
Okay, so hello everyone, my name is Rui, for those who don't know me yet. You'll also have the opportunity to know me again tomorrow when I present the tab. Thank you for your trust and for electing me to be the chair of the Business Opportunities Group. So I only have one slide, it's very simple. because we see after the discussion I have actually a set of slides that I completely killed because we ended reflecting a bit upon this, and we see that the working group for business opportunities is all about generating the business opportunities for the ETPN and bringing opportunities to the members. So we act more as of a support structure that needs to be closely working with all the other working groups that are responsible for the different areas. So yeah, basically that's the vision that we have, which is to act as a support structure to the ETPN and other working groups towards business activities and opportunities. And the concrete actions that we are willing to implement in the next 2 years, they are all about exposure and all about translating things from the ETPN and members to the market and bringing them to the patients. So some things that we can do, for example, is to build a portfolio of the ETPN technologies. So create licensing opportunities, brokerage events where you can expose your projects, your inventions to the industry, for example, to license out or even create companies or joint ventures with the industry, which is always important. And this is here, the communication, that's why we are towards an articulated strategy with all the working groups and acting as a team, because it's crucial that each working group curates which technologies are there, and they should champion each field that they are working on. So, and also, once again, exposure. So, showcases to industry, like we've done in last year with Medtronic, so in which members apply to have their project, to pitch their projects to the industry, and they are selected by these companies that come here. For example, investor days, so you can find opportunities to pitch and garner funding for your projects as well, and also focus on other revenue possibilities for the ETPN. So, for example, mapping out and cataloging the ETPN members' capacities, for example, as service providing opportunities in which you can attract more, so provide services and also go get more income from that. And also map out who is investing in nanomedicine, which companies are active in this and those fields, and create this as an accessible portfolio. So we have on one side the portfolio of the technology of the ETPN, which external partners from the industry can access and even pay for it to reach out to the people, and also the opposite. So map out who is doing what and who is investing in what, and give this to the members so they can find these opportunities to bring their projects to the next step. So always in close articulation with all the working groups and with the hub and all that. So there is still a lot to go and a lot of discussion to have with your other working groups. That's why this is only a simple slide and very short. And that's basically it. I could speak for 10 more minutes about this, but I'll just be running around in circles. So the word is on your side. So if you have any questions, just let me know. Thanks.
We have 1,000 people in the hall waiting for us.
Hi, Rui.
Hi.
Short question.
Yes.
Do we have promotional content ready so we can use this content to promote ETPN? I mean, if we would like to expose or just to engage another partners, I think we should better have some sort of maybe abstract or some sort of promotional content that we can use when we would like to do this sort of promotion.
Yes, exactly. That's the work in progress part. Starting from today on, will be exactly that. So first of all, we have a lot of content that we can recycle. For example, the videos we've made, even still in Anatrans, where we talked about IP, how to protect your technology. We can even do more things close with education, for example. But we can also start having a template which has to be created so you can create your technology offer, so to speak. I use a lot of tech transfer terms because it's where I come from. So it's more or less like that. We have to work on that content and generate it. It's not only practical content, but also go generate it in the community.
Okay, thank you.
Excellent. Okay, so now we move to the other working group, which is medical device. If Lorena may come on stage, please. Lorena.
Thank you. I'm sorry, but this is all very last minute. So, Lorena Dieguez, for who doesn't know me, I'm a researcher here at INL, also CEO of a small startup which is spinning off INL, and I'll tell you more about that tomorrow. So we had the working group meeting for medical devices this morning. I had some slides ready which we discussed, and of course we had to, we had a very fruitful discussion, and hence I was trying to put together all the input that I got from all the people that joined. So in a nutshell, when I arrived this morning, this was the team of people that had put their hand up saying that they would like to participate in building the new medical devices working group. And so they are going to be very active into the different tasks that we have defined. But of course, this morning, this is the people that join the meeting. So this is my mailing list at the moment. So one of the first actions that we are going to take forward is, of course, to do mapping of what is the people that is interested in the medical devices working group, so that we can start, working together. Very much like my colleagues, we have discussed on these three main pillars: how to make research activities in this field sustainable, how to make the translation of medical devices from the lab to the market sustainable, and how to gather more people into ETPN. And for that, we believe the common answer is to create cross-working group task forces. So we are going to try as much as possible to work together with everybody, because we are not interested in the one only working group, and their synergies wherever we look. So we designed, and forgive me for the ones that were in the room this morning if I missed some of your inputs. I'll work on this further before I circulate. So first thing to do is to compile a list of Horizon 2020 calls for what remains on the work program that we can perhaps work together for. We also want to influence the new work program and designing together with the Commission the new PPP Health initiative. We want to promote perhaps simultaneous development of drugs and diagnostic tools towards creating a companion diagnostic strategy in Europe. We also want to involve health technology assessment early on, because let's say the paradigm is to invest in technologies that can potentially be translated. So we need to be smart from the beginning of the development of the new technologies. And we also discussed on how to implement the circular economy paradigm into medical devices. This is how we translate the mission into practical, concrete action plans, and we have prepared some. So it's not like these people are going to be responsible of doing the whole action. It's just that they are going to be responsible of dynamite. Sorry, Angel. I know I scared you out now. Eusebio was in the room. He gave your name. No. So we are. He's there. You can blame him. No. No, we just meant to put one name forward, so that each and everybody of us has got like one responsibility, so that we can all work together, but there's going to be one person making it dynamically. So the suggestion from Paul has been to, where am I? Was to prepare a position paper. So before we get the question from the Commission on what are the topics that we won't cover in the next work program, we want to anticipate to that. And so we invite you all to contribute to this position paper. So we will define, or Paul perhaps will define with us, some key areas, and then we can all contribute. So towards establishing a companion diagnostic strategy in Europe, we directly see that we need to work together with the nanotherapeutics working group, but we also see that we need to engage the regulatory authorities as soon as possible. And for that, taking advantage of the presence of Robert Gertzma, I don't know if I'm pronouncing that properly, we want to see how to connect ETPN with the new technologies working group. Then we also see this problem about how to fund basic research, but what we need to do is to involve health technology assessment from early on and start developments from a quality by design principle, so that then these technologies can be translated. So now going into how to translate the technologies to the market, these are the points that we highlighted this morning. So that's the promotion of a medical pull versus technology push approach, very much in line with the talk from Patrick earlier. Involve clinicians and patient associations as well early in the design, engage the medical devices industry, introduce medical devices into the TAP. That's already ongoing with the new health tech TAP, but we want to work together with them. And also what to do for reimbursement in Europe. It would be very beneficial to have like a common ground for reimbursement across. These are the concrete actions that we designed. So we believe that if we can all go together and prepare a list of the clinical partners that we work with at the moment, and highlighting what the expertise is. We can also promote a healthy relationship with industry, and that I'll take care of together with Andreas and Ray. We believe that we can take advantage of this connection with the regulatory agencies and prepare a webinar, so very much in line with what has been discussed for education, and also to offer as a benefit to ETPN members. So webinar about IVDR and MDR. And also we see here that we need to work very much together with the Safety and Characterization Working Group. And finally, we were talking about the working alongside the TAP, and we believe that we have to integrate the three open innovation testbeds in medical technologies to work together with the TAP to help this translation of medical devices. And finally, to increase benefits to members, besides everything that I said, because it's very difficult to put these tasks in different buckets because they are all acting in the three levels. But what we see directly for ETPN is to prepare a brokerage tool in which we can map all the peers that are here, that are members of the ETPN. There has been some mapping before, but I think that needs to be updated. And so once again, to engage the different stakeholders. And so those are the concrete action plans. So again, the webinar for regulation I mentioned, but also to have a multi-webinar from clinical experts so that new members can benefit directly from all this, let's say, multi-stakeholder or holistic approach. And that's all from my side. Thank you.
Any question?
Why? Your name is there because.
Yeah. I can fight that. No. Just a small reflection about. Okay, we are, in principle, we are for, if I understand it, nano-enabled medical devices, or are we going together with MedTech Europe, or, I mean. Is this intended for any kind of medical device, or?
Well, I think that nowadays where we sit is in nanomedicine, right? So nano-enabled medical technologies or medical devices, if you want. But I think that indeed Horizon Europe is going to make this shift, and so we can take the lessons learned from the nano-enabled medical devices then into any new trends in medical technologies. So we are going to have to be smart and see ahead. So of course our expertise lies in nano. So that's our starting point. But then we need to see beyond.
Yeah, but I know a guy that will start now in MedTech Europe. So yeah, probably so the principal interconnection is to connect the group with MedTech Europe.
I completely agree, and I think that's something that is actually written in the action plan between the lines.
Is Patrick Boisseau our action plan? Guys, you missed an episode, right, I think. Oh, it doesn't answer my email anyway.
I'm Stefano Salmaso, a professor at the University of Padova. I have just a comment, and I'm very happy that also Ruth Smith is past president of CRS, so she knows what is the environment on the academia, and I'm also connecting to one of the questions that was raised before about the benefit that academia can have when we participate to this working group. So it's not a comment to that specific working group, but it's very general, and I see that that is very relevant to have a showcase of all the facilities and the expertise that we can gather to each single working group, but there is also an active role of the working group, which can be the brokerage that you also show, and probably a connector or a facilitator of proposal, for example. This is something that is very interesting for the academia, because yeah, we need to share information and have a critical mass to do proposal. But I really appreciate this opportunity for brokerage. Thank you.
I don't know what to answer to that, but yes, that's why. Regardless of what is our standpoint and what is our expertise, we need each other. So not only from the ETPN side of things, in which we need to work together, but for the research point of view, we need to have the collaborations in precisely in the areas in which do not work. So in which us do not work, and so that's why. So mapping generously the different stakeholders that are going to be involved, and that's not only the different areas of research, but also all the other stakeholders, is going to be crucial to attain funding, but then also to all the other, let's say, goals of the value chain, so to translate and so on and so forth. So I very much agree. I think everybody's looking forward to the coffee break.
Did we do all the working groups? No, Marcia, please come on stage. And the education also, yes. You know what, normally I should feel really ashamed about the delay, but this time it's so important. I mean, we all feel that we are in this transition. No. Everybody hates coffee in this room, so.
Thank you. So good afternoon to all. I will be very fast. So this morning we were a very small group, but very strong. They give us a very strong contribution. So my name is, my name is Marzia Bedoni, as you already know, and my vice chair is Maria de la Fuente, please. Maria. Maria works in nano-oncology unit in Santiago de Compostela, and so we are two different expertise, because my group is a research hospital. Research hospital expert on neurological, cerebrovascular, cardiovascular disease. Meanwhile, Maria is expert on oncological field of research. So our vision was to start to align with the New Horizon Europe vision. So not to technology driven, but listen to doctors. So our idea is that nanomedicine is a matter of medicine more than nanotechnology. So we push all the research projects and ideas that are disease oriented. So our first action plan was to collaborate with the TAB activity, creating a mentoring activity pre-TAB. So we promote and we support the research project that fit with the unmet clinical needs. So we want to start by the clinician point of view and by the patient association point of view. So we want to help all the research project in TRL 3 and 4 phase in order to orient only the research projects that are disease oriented, and then we also would open the discussion and help in these phases with the clinical interface trial centers networking, and to increase this networking with the clinical trial centers. In fact, we want to have an updated version of the nano clinical trial center, starting from the NTRANS deliverables, and we want to involve and to increase this networking with the new clinical trial centers that are nano-oriented, nano keywords, And afterwards, we want also to update the version of unmet clinical needs, moreover, starting from ENA-trans deliverables. That is a good starting point for us. And we want to invite clinicians to answer a survey, a questionnaire on ETPN website, but also in our research hospital, because we have several networking with many clinicians from our hospital, not only for example, Dognocchi Foundation has 30 centers in all the Italy in different regions, so we can involve several different clinicians. And also to, as other working groups said, to increase the visibility thanks to thematic webinar, for example, from our clinicians, but also from different stakeholders. And then we want, regarding the social impact, we want to collaborate with the local health agency and government and maintain, where possible, to increase the collaboration with them and to increase this collaboration. We want to create a great group of patient association in different diseases, not only in the main disease like cancer or neurological, but also, for example, from sepsis or different infection disease. And regarding we want to create a document stating the social impact of nanomedicine in healthcare. And these are in a bullet document. We have the key decision during our working group meeting in this morning. And the first of all, we want to prepare and share a document with the main action in order to attract new members. For example, to open our working group meeting not only for the ETPN member, but also to the other participants in this conference or in the future conference. And to clearly also define the clinical and social impact that can benefit from the application of nanotechnologies in the several diseases, as I already said. And to clearly identify and define the unmet clinical needs, that is the main points. And in order to define a regulatory landscape, we can take into consideration from early stage in the development of nanotechnology to really favor the translation in the technology hub and to near the patients. So the last consideration, and that we have to be a source of information for all stakeholders, clinician, patient association, developers, healthcare system, to be attractive and useful instruments for all members, ETPN members, but for all the community of several stakeholders. So I finished. This is the very small group. So.
Excellent. Any question? Like super flash, extra fast question? 1, 2, 3. No.
No.
Jack? Can you come on stage? Oh, you can. I cannot hear you, Jack. Ah, yes, this, like, I would do it. Mm-hmm.
I bring one from my home. Anyway, I put the recording on autopilot. I hope it won't crash while I'm talking. Together with Marco, Georgina, and me, we are the education and training work package. I am really very honored to be elected and excited, so you can feel it from my voice. I have only 2 slides. We've been working for a couple of weeks, not only in the framework of this group, but as a whole group with Ruth, trying to establish our vision. And you can see that some of the items like survey and things like this repeated in some work packages. This is because we are working as a whole team, and this is a good thing. I'm sure that you can read these action items that we established together in these couple of weeks, even faster than me. But just before, I would like to give our vision for this work package. What I really think that we should do is to bring this ETPN community to a point that you will feel the need to be in contact maybe each week or each day. If we can support or provide things that you will need in your daily life and the means that to create this contact ad hoc whenever you need, then I'm sure that we can become a very interactive community. And maybe for this, we don't need to invent or reinvent the wheel. There are many social tools that enable us ad hoc to contact to each other. And especially the young generation, who we should address mainly, are very oriented using these tools. So by these tools, if we can make the interaction from one hand very simple, and from the other hand, instead of creating the content by few pointed people and try to feed you with new content only by few selected people, I don't think that we can gain critical mass to make ETPN very attractive. The idea should be that each of you will be able and willing to share your content, and in a way that you give some and get much more back. And we need to discuss and explore the ways how we can do it. If we can do this, I'm sure that ETPN can be very good success, as it happens in other social medias like Facebook or YouTube. Unless each individual couldn't come to the point that can contribute to community, these things doesn't get the critical mass. So most of the topics that I will talk about are based on this vision to see how we can facilitate or build a platform that it's very easy to cooperate and you can all share content and get benefit of it. Well, first, as other group chairs indicated, that we need to identify the gap, what is already here and what we should add. For this, we need to find a way to identify this gap. This can be a survey or maybe a focus group that we ask selected people what they are thinking of ETPN, what kind of services they would like. And then, of course, we can do this survey or this need analysis in broader way with all the work groups, or each work group it's on our own. And of course, as I said before, we would like to build a knowledge hub. This means that we would like to save you time to search the web and validate information, because the information is there and it's flooded. The important thing is to locate it and to retrieve it in a way, that critical way, that we can verify that the information is valid and good. And of course we can, as already other workgroup leaders indicated, that we can aggregate content which is relevant for you, either content that we produce or you produce or you find and you would like to share with the community. We have quite a lot of content from previous meetings. I've been in previous projects like Enetrans, recording some scientific talks in previous ETPN meetings, Malaga and Crete, and we can try to see if we have the proper rights to use this content. I'm pretty sure that it's feasible. And let me check the other slide. I told you it's going to be very short. The idea is that some of the things are already in the website, but I'm not sure that it is easy enough to use. So I want to try maybe out of the box things like maybe WhatsApp group for people that have mutual interest on some topic. Maybe to create virtual groups based on something that you use daily basis on your phone, because I think even accessing to the website, it's becoming too much for most of us. We would like to just take our mobile and search the answer or get the contact. We need to see if such an approach is feasible also to implement in the framework of ETPN. One of the examples for such a thing could be, for example, choosing a video conferencing tool which will be available for the partners and schedule it for direct connection. Using Blue Jeans, Zoom, there are a lot of video conferencing software and means available, but they are, you need to buy them. And sometimes at your university, it could be problematic. At my university, it's so complicated that I need to buy such a thing. I sometimes prefer to buy it from my own money. But if ETPN can do it, it costs maybe 20 euros per month. It's not much money, but the procedure is too complicated, and people sometimes gave up purchasing it. So if you can do such a thing, and we can make a scheduling, and partners can ask for time slot using this video conference for communicating and coordinating things, it could be a good approach. Okay, another thing could be, it's on my expertise, for example, identifying or locating tools that you can produce by yourself, good lectures or presentations, including video, and you can share them. You can share them, for example, for papers that you want to submit, but also to share with the community. If you have a breakthrough in some research and you would like to share it, maybe if we will give you the right tool, which is very simple to use, and you can in 5 minutes make a good presentation with your slides along your presentation, and you can upload it to someone, to somewhere, then it could motivate you more to share your content. Other approach could be trying to engage the academia to provide courses that can be used by students or by ETPN members. I just checked this approach, and we recently recorded a course with Tel Aviv University and 2 universities in Sweden, and this course was successfully recorded, and I asked the permission of, we have a lot of feedback, asked the permission of the authors of this course to share it with ETPN members, and I got this permission. So, for example, course on chip, organs on chip can be shared by the ETPN members, and maybe you can also try to locate such courses at your universities and share them, so it can be also a good benefit for the partners. I have a lot of much to talk, but I know that you want to drink your coffee. And yes, I will let you go.